So in 2015, there was data that came out that showed about $15 million of online sales. By 2015, that had grown to $180 million. But we're seeing more and more of the sales being shifted to the online. I think as we start to reduce lawful prescribing, so a lot of the addiction was people who became medically addicted, who got lawful prescriptions and became addicted to opioids. As we see doctors start to prescribe fewer opioids, we're fearful that more and more of the new addiction is going to shift to illicit sources, and a lot of those illicit sales are taking place online.
Facebook, Google, Bing, Twitter, all of them, what do they say about these sales on their platforms? What are they doing, and what more do you think can be done?
Well, I think they've been helpful. They've been cooperative. We've been working with them quietly for some period of time right now, and they've taken steps to try to crack down on these sales. I think in all candor, they're a little bit defensive. I think that they don't fully see what we see, which is a lot of these sales taking place online. But they're coming around, and they want to be helpful. And we want to work with the legitimate internet firms to crack down on these sales. We're also shifting a lot of resources, a lot of our criminal investigative resources, into cracking down on the online sales, particularly what's taking place in the dark web and what's taking place on the illegitimate websites. And so at the same time we're doing that, we want to work with the people who want to be good actors, the Facebook, the Googles of the world, to try to take steps, proactive steps, to try to stop these sales. And there's things they can do. They can de-index. They can stop certain advertising and listings. They can redirect users to legitimate sites when they look for illegitimate sites. So there are things that they can do, and they have been doing it.
Let me ask you this. You say that they don't see the things that you see. How do you know more about what's happening on their platforms than they do?
Well, I don't know what they know, to be candid, but we're looking. So we spend a lot of time looking at what's going on online. This is an area of intense focus for the agency, and we still do see a lot of sales even on the surface web. So I think there's a lot of chatter that a lot of these things are taking place in the dark web, and that's true. A lot of them are on peer-to-peer sites and deeper in the web, things that can't be readily accessed. But we still see a lot of sales on the surface web and a lot of advertisements. I think the refrain is that a lot of those sites aren't legitimate. They're just set up to steal data from users, steal their credit cards and other things. But a lot of them actually do allow you to complete transactions for illicit drugs. And one thing to remember, when you go online, you buy illegally, because all these sales are illegal. You buy opioids illegally online. You think you're buying Vicodin and Percocet or OxyContin. In many cases, what you're getting is pressed fentanyl. And that's why we're seeing overdose deaths go up as well. People are getting lethal doses of fentanyl that are masquerading as a Percocet or a Vicodin.
So your hope is, if we're talking about over $180 million, or did you say $180 million?
It's well over that. That's a 2015 figure. I mean, it's been growing very rapidly. It's just the pace of growth. And we don't really have an accurate handle on a total amount of sales. It's a lot. There's 800 million packages coming in annually through the international mail facilities, growing at about 80% a year. A lot of those packages contain illegal drugs in them. We've been cracking down on the IMFs as well, the international mail facilities.
Dr. Gottlieb, I want to thank you for what you're doing on this front. I have to say, you are somebody who has been so actively involved in trying to do anything you can at the Commission to try and change some of the problems that you see are out there, and this is just the latest example of that. I also want to ask you, though, about some news that we had yesterday. Amazon buying PillPack. That crushed a lot of the healthcare stocks yesterday, and it really boosted Amazon's shares. Just wonder what you see at the FDA, what you think about a move like this, and if you've been watching this arena in particular.
Well, I saw the deal, obviously, and we work with the distribution system and the pharmacies to try to maintain a closed supply chain. My understanding is PillPack operates as a pharmacy. It operates 49 pharmacy licenses in different states. I'm not sure if they're just a pharmacy or they're also a repackager, so I'm not exactly sure what their exact business model is. I haven't taken a close look at it, to be perfectly candid. But we do work with the legitimate supply chain to try to maintain a closed supply chain. It's very important, the relationships that we have with them, to try to safeguard the supply of pharmaceuticals in the country. Amazon
getting involved in this arena, is that a good thing from your perspective, or are you concerned about it?
Well, I think competition is a good thing, and I think disruptive competition is a good thing. So anything that can make these products more accessible to consumers and lower costs in the supply chain is going to be a good thing. The supply chain, the intermediaries are a cost on the system, and so seeing more competition come into that marketplace will help bring down costs, maybe promote use of generics, things like that. All those things are good.
You're a markets guy, though. Amazon buys this and wipes out $17.5 billion in value from these other companies. Because you do have a market sense, does that make sense to you?
Well, I don't comment on equity markets from my current position. We'll have to see how this plays out. I think there's still going to be a real important role for the brick and mortar pharmacies and people who are incumbent players in this space. People like to go into pharmacies. When you go in and you pick up your pills in a pharmacy, you're also picking up other things as well. So my sense is that this is going to be a slower evolution in the market towards more disruptive systems. There's a lot of reasons why the incumbent players have built a lot of market share here, and they're important. We work closely with them, and they're very important to trying to maintain the integrity of the system. But I think what you're going to see hopefully from more competition coming into the space is more people looking for ways to try to do things like promote generic utilization, all the things that we try to promote as public health virtues to try to decrease prices and increase competition in the market.
So you're in favor of things like the Amazon, JP Morgan, Berkshire Hathaway initiative to try and tackle healthcare costs. I'm guessing just based on your comments, you'd like to see costs come down too, any way possible through competition.
Well, my sense is that they're aiming at the employer markets. They're aiming at something a little bit different than what we're talking about here. But yeah, look, we're seeing a lot of entrepreneurs come into the health services space. I think for a while, you're right, I worked on the other side of this when I worked in venture capital, and we saw underinvestment in healthcare services for a period of time. I think we're seeing more investment coming into healthcare services, more disruptive ideas, and I think that that's a good thing because we do want to change the delivery system to try to make it more efficient.
Hey there, thanks for checking out CNBC on YouTube. Be sure to subscribe to stay up to date on all of the day's biggest stories. You can also click on any of the videos around me to watch the latest from CNBC. Thanks for watching.